Good afternoon, everyone. It is 1 o'clock on Thursday, July 2nd. So I think we're going to get started with our session. And I just realized I need to turn on my volume. It was turned down from something I was doing earlier. There we go, just in case that makes a difference. All right, so good afternoon, everyone. Welcome to our live webinar for Thursday, July 2nd. On Tuesdays and Thursdays through the month of June, these were live exercise sessions. So that will be our plan for today, even though I guess technically it's July. Walking Talk with Rob is what we call these sessions. I am your host. I am Rob. I will be doing some walking and some talking with you. So these exercise sessions are pretty low intensity. So I think everybody should be able to do them, but ultimately they are designed for people who are already participating in an exercise program or a cardiac rehab program. If this is your first kind of kick at the can in terms of starting an exercise program, it's probably a good place to start, but we really do encourage everybody just to make sure that you're cleared for exercise by your doctor, especially if you're a cardiac patient, right? We always tell people that we like to get people exercising 5 days per week. I mean, the target for physical activity is 150 minutes per week. I only do 2 of these sessions a week, and they only have about 15 minutes of cardio. So 2 times 15 is 30. You guys still owe me another 120 minutes. So if you'd like to do these sessions multiple times later in the week, as an example, we do host them on our webpage, cardiaccollege.ca. So you can always go there and watch some of the earlier recorded sessions if you want to go through, right? While we're doing the exercise, there's only a couple of things that you should feel. You should feel your rate of respiration go up, so breathing a little bit faster. That's a normal response to exercise. And you might feel a little bit of fatigue in your legs. I was just chatting with a colleague of mine, one of our program physicians, who says that she does these with us at home. Her knees sometimes get a little bit sore as well, she says. So if that's normal for you, that's fine. If you do develop any pain while you're doing the exercise, it's important that you acknowledge that. Slow down, stop your exercise. Hopefully the pain goes away. If stopping the exercise doesn't get rid of the pain, then we encourage you to reach out to emergency medical services. All right, so those are our disclaimers. And for today, hopefully you've been feeling well. Hopefully you all enjoyed Canada Day yesterday. You should be symptom-free, so no chest pain, no shortness of breath, no dizziness, palpitations, lightheadedness, or anything like that. Hopefully you have all taken your medications for today. And for those of you that are living with diabetes, that your sugar is at a safe level for exercise. Not too high, not too low. And the Goldilocks rule, they call it, right in the middle. All right, so let's stop my screen, get my big face here, and let's get started with our exercise. Okay, so the first thing that we do before we do our exercise, let's get our resting heart rate. Make sure that it's in our normal range for you at home, whatever that happens to be. So if you can find your pulse here at your wrist or at your neck, either location is fine, that would be great. And we'll check your pulse for 10 seconds on my count. So ready and go. And stop. All right, so hopefully you've been checking your resting heart rate on a regular basis. And at home, you know what normal is for you. Typically, our patients will get a count in 10 seconds between about 10 up to about 16 or so. A lot of our patients, of course, are on medications that do slow the heart rate down. So it's not unusual for us to see heart rates of 9 or 8 or even sometimes 7 in a 10-second count. All right, so let's get right to our dynamic warm-up to get ready for our exercise, get everything loosened up and ready for the activity. We'll start off with a little bit of marching and get the big muscles in the legs warmed up for our exercise. Get the knees and the hips moving a little bit. These are good things to do. We just do this for about 15-20 seconds or so. Okay, now let's loosen up our hips. So I'd like you to hold on to something that's good and solid, that's not going to move. Hold on tight. Stand up nice and straight and tall. And then let's just loosen up our hips with some hip swings. For those of you who tune in regularly, you know I like to say slow and deliberate. We're not looking to do anything super fast or ballistic, just to kind of loosen the joint up comfortably. Okay, and then let's switch around and let's do the other leg. Okay, there we go. Feels good on the hips. Get them all nice and limbered and moved up. Okay, we're going to do our ankle rotations next. So lean up against something for balance. And then we're doing big, deliberate circles with our toes. And make sure you get both directions. And then the other foot. And the other direction. Okay, and then let's finish off with some shoulder circles. This is a good exercise to do a few times throughout the day. I've been doing so much sitting over the last few months. We're all tight and stiff. This is a good way to loosen up. Get both directions. Okay, so those are our 4 dynamic warm-up exercises that we do before we get started. And now let's get into our cardiovascular warm-up. And we all know that for our warm-up, whatever activity we're going to be doing for our exercise, warm-up is that activity, just done a little bit slower. Gets all the muscles warmed up. It lets our body optimize the blood flow. So if we're going to be doing an exercise that uses our legs, we need more oxygen-rich blood going to the legs. So the body will start to dilate the blood vessels going to your thighs, and you'll send more oxygen-rich blood that way. Likewise with your heart, and this is important for our cardiac population, it gives your coronary arteries a chance to dilate so you can get more oxygen-rich blood to your heart as well, which is important. It's always important. Okay, so we're going to do our warm-up for about 4 or 5 minutes before we start our main aerobic exercise. And let me see, so just another announcement. I mentioned this on Tuesday, but I have to share this again for anybody who missed me last week. This is probably going to be our last live session for the month of July. I'm on vacation next week, so that's good news for me. And when I come back, we're going to be opening up our program in a very, very small capacity. We're going to start bringing a few people back through our testing labs and out onto the track, which is great news that we can start to open up. But it's in a very, very small capacity. We used to see groups of 50 people in an exercise class here in our program. We're going to be seeing no more than 12. We used to have classes every day of the week, and we're going to start off with 1 day. However, there's a lot of work involved in trying to reopen the program safely. COVID is still out there. We know that, so we want to make sure we try and eliminate as much risk as we possibly can. So we have to think about how we do that thoughtfully. We're changing the way we deliver the program a little bit. Classes will be a little bit shorter. Got to do a lot of cleaning between every group that comes in. So things are changing a little bit, and we're spending a lot of time trying to get that ready. So unfortunately for July, I'm going to be spending my time trying to get the program ready for people coming back in. So I'm going to have to put these sessions on hold for hopefully just a month. Hopefully I'm back in August. So I had to share that with everybody. I forgot my last slides on Tuesday. We have one more session that's going to be happening Monday at 1 o'clock. My colleague Renee is going to be talking about intimacy. So that's going to be our topic on Monday. That'll be our last 1 o'clock webinar session for the month. All right, I think we got 1 more minute of warm up and then we can push a little bit harder. Now, one of the things everybody knows is it's been really, really hot outside, especially of late. So it's very important that we stay hydrated. So hopefully everybody has some water with them. Feel free to have a few frequent sips, frequent small sips of water is a good way to go. Unless you're on a fluid restriction. If your doctor has told you have to be careful about drinking water, listen to your doctor. Okay, so I think we're warmed up. For those of you at home, if you'd like to walk a little bit quicker, just to get your heart rate to come up a little bit, please feel free. If you're feeling really motivated, you can add a little bit of arm action into your marching as well. This uses a little bit more muscle. And of course, the more muscle you use, the more oxygen-rich blood your heart needs to pump, which means my heart's working harder by doing this. Gives me maybe a little bit of a better workout. But only if you feel comfortable doing this. Because I'm doing all this talking, I'm going to leave my arms down here. Don't want to get too short of breath while I'm trying to talk to you guys. Okay, so we didn't have any questions that I didn't answer from Tuesday. The question about biking last session that we answered, and one other one, I can't remember what it was, but I did answer it. So we had no outstanding questions for today. So I thought I'd spend a little bit of time just talking about heart rate and some of the technology that exists for measuring it. So you guys know that we always try and get our heart rate at the start of the session, our resting heart rate. And then we always try and get our heart rate at the end of the session, the exercising heart rate. So why is that? Why do we care? Well, one of the big things we're trying to do with our exercise is strengthen your heart. Okay? Your heart is a muscle. You often hear me say it's a muscular pump, roughly the size of your fist, made up of 4 chambers. It's got one job, one very simple but important job, and that's to deliver oxygen-rich blood to every cell in your body. That's your heart. Likewise, the heart being a muscle, if you can exercise train it, it's going to be stronger. It's going to pump more efficiently. It's going to be a healthier organ. Who cares, you might think? My heart's with me all the time. It's working. Well, we know the fitter and stronger, if you will, that your heart is, especially from a fitness point of view, the longer you live, the less likely you are to have cardiac problems. A whole bunch of other health problems are associated with exercise and fitness. But mortality, how long you live, is really tied into having a good, strong, healthy, fit heart. And exercise is how you're going to train that heart muscle. But like everything else, it's important that you don't do too much. Likewise, it's important that you don't do too little. And checking the rate at which it beats, the heart rate, is how we determine if you're exercising at the right rate, the right level. So every time our heart gets stimulated by a little electrical impulse, that electrical impulse passes over the heart, and that gets the heart to contract and push all the blood out to the body and the lungs and whatnot. And every time the heart contracts and pushes blood out, in particular the blood that's being pushed from the left ventricle out through the aorta, it creates a pressure wave through the arteries in your body. And you can feel this pressure wave through arteries that are close to the surface of the skin. So of course, the radial artery in the wrist is the one that we often use here. It works quite well. There's also your carotid artery, which is just below the skin here, the surface in your neck. So we can use that one. But there's other places that arteries are quite superficial that you can use to check your pulse as well. I often will joke, you get some of those people, they get really angry, and they get this vein throbbing in their head. Well, you can actually use that to count their heart rate, especially if it's really visible. So you can get it there. Last session, I think we talked a little bit about blood pressure. Well, when we're wrapping that blood pressure cuff, the sphygmometer around your arm, we're actually occluding through the brachial artery, the flow blood through, so you can use that to get your heart rates. Some people, the webbing between their thumb and their first finger, have got a little bit of a pulse in there, in your groin, back of your knee, top of your feet. There are lots of different places in your body where the arteries are close to the surface of the skin, and you can use that to feel that pressure wave that's generated by your beating hearts. We want to make sure that the rate is appropriate. People say, well, Rob, what is that? How do I know? Well, it's kind of tricky for our cardiac populations because one of the medications that we give a lot of our cardiac patients, or a number of the medications, affect your heart rates. And if you think about it this way, if I sprain my ankle, go to the doctor and the doctor says, Rob, you've sprained your ankle. If you want your ankle to get better, rest your ankle. Maybe we'll put it in a cast or a bandage or something like that. And the doctor says, yeah, don't use your foot for 2 weeks, 4 weeks, 6 weeks, whatever the doctor ends up saying. And that lets me rest my ankle. And as I rest my ankle will heal up. It'll get hopefully back to normal, and I'll be good. But if you damage your heart, let's say you have a heart attack. A heart attack is when we starve part of the heart muscle of oxygen-rich blood for a long enough period of time that we actually kill it. Right? Typically, that occurs when a blockage in a coronary artery kind of ruptures, and it goes from a 30, 40, 60, 80% blockage, and it expands real quickly to 100% blockage. And then all the heart muscle downstream of that blockage gets starved of oxygen-rich blood, and it will die off. That's a heart attack. Completely lost my train of thought. Where was I going with this? Let me think here. It's been a long day, folks. Oh boy, I completely forgot my train of thoughts. Crystal, help me. Crystal's our IT person. If you damage your heart, now I remember. If you damage your ankle, don't use your ankle. If you damage your heart because you had a heart attack, well, you can't just not use your heart. You always need to use your heart. Without it, we're in trouble. So one of the things that doctor will have you do is they'll have you rest your heart. They'll tell you to take it easy for a few weeks, first after you've had the heart attack, but then they'll give you medications. One very common one is something called a beta blocker. Metoprolol, carvedilol, sodalol, bisoprolol, nadolol. All these drugs that end in OLOL are typically classified as beta blockers. And one of the things they will do is they slow your heart rate down, they lower your blood pressure, and if your heart rate and your blood pressure slow down, your heart's not doing as much work, it can kind of rest a little bit. So this is a very good drug to give cardiac patients. If you damaged your heart, let's let it rest for a little bit just to try and heal up a little bit. But the problem with that when it comes to checking heart rates is everybody responds to these medications a little bit differently. I might take 5 milligrams of bisoprolol, which is a pretty common dose, and it might really lower my heart rate a lot. So when I exercise, my heart rate might not come up much at all. Somebody else might take 5 milligrams of bisoprolol, and for some reason it doesn't affect them to the same degree. And it might only lower the heart rate a little bit. So everyone responds a little bit differently. So if someone says, getting back to heart rate, well, Rob, what should my heart rate be? I'm on a beta blocker. It's impossible for me to look at you and say, this is the number. I'm going to have you do a stress test. And in a stress test, for those of you that had them downstairs in our labs, just right underneath me right now, what we do is we put you on a bike or a treadmill, and then we measure your heart rate while you're exercising. And then we see exactly how does your heart respond to set amounts of exercise. And when you do that test here with us, you guys will know that we tell you, take all your medications as usual. If you're taking 5 milligrams of bisoprolol, take that like you normally would, because then we can measure how your heart responds to exercise while you have that much medication in your system. And then based on everyone's unique response, unique heart rate response, then we can go and say, okay, Joe, your heart rate with exercise needs to be between 14 and 16 beats per 10 seconds. And then Mary, your heart rate needs to be between 22 and 24 in 10 seconds. And it's important that if we give you this range, it's all going to be customized to everybody, that you try and get as close to that range as you possibly can. Why is that? Well, it goes back to the beginning of our conversation for today. Your heart is a muscle. If you want that heart to get stronger, healthier, and fitter, it needs to work. It needs to do the right amounts. And that's the big part of the job that our exercise staff here will do, is they'll determine exactly what the right amount is. Too much is going to be a problem. Make you feel unwell. It can cause problems with your heart. But likewise, not working hard enough, I don't really want to say you're wasting your time, but you could be getting a lot more out of the time you spend exercising. So that's why we want to get your heart rate up to those target ranges. So if you've had a stress test, it's always a good idea to ask your exercise professional, what should my training zone be? Because it's got to be customized, it has to be individualized, especially if you're a cardiac patient taking medications that will affect your heartbeat. All right, I think we got another 2 minutes in us, and then we'll start our cool down. We're gonna have another sip of water. That's good. I think I see some questions popping up on my screen. So I'll have something to talk about towards the end here. And for those of you at home, my screen's about 15 feet away from me, and the pop-up boxes are about this big. Other than the fact that I see them, I have no idea what they say from all the way over here. So we'll see. All right, let's do another 30 seconds, and then we'll get our exercising heart rate, as we've been talking about. You guys will remember that when we do get the exercising heart rate, it's important that you keep the muscles in your legs contracting and relaxing a little bit. My heart is moving blood right now through my body, but the muscles in my legs are helping out. They're contracting, relaxing, contracting, relaxing. And as they contract, those working muscles, one of the things that they'll do is they'll help squeeze and push blood back up to my heart. If I all of a sudden stop using my leg muscles, not as much of the blood's going to come back, and that can contribute to people getting lightheaded and a little dizzy. All right, so let's get our exercising heart rate. As I just said, we're going to keep moving. I always like just to kind of sway back and forth a little bit. Find your pulse at your wrist or at your neck, whichever one you prefer, and let's get a count in 2, 1, now. And stop. All right, and we'll do our cool down. So hopefully you've been checking your exercising heart rate at home on a fairly regular basis. Hopefully you have an idea of what your normal exercising heart rate is. Can't tell you what that is without seeing a stress test, but you should get used to what that value is. For some people, it might only be 1 or 2 or 3 beats in 10 seconds higher than your resting value. For other people, it might be 10 beats higher, 12 beats higher, and that's all fine. Okay, and everybody keep doing your cool down. I'm just going to see what kind of questions I have here. Keep cooling down. Don't stop. Keep doing your stuff. Let's see. All right. So I've got 2 questions here. While I'm doing my cool down, what is the difference between walking and cycling? That was a question that I was asked actually on Tuesday, and I answered it then. But ultimately, all your heart knows is legs are moving, send blood. So whether you're biking or walking, your heart doesn't know. So as far as a conditioning point of view, there's no real difference. It's more the orthopedics. I've got really bad knees. Walking might not be the best thing for me. Maybe I should bike. Likewise, if maybe you've got really bad hips, maybe biking doesn't work for you and you should walk. But as long as you get your heart rate beating at the same rate for the same amount of time, whether it's biking or walking, you get the same benefits. And the other question was about something called an NSTEMI and how much activity you should do. So an NSTEMI is a medical term that stands for non-ST elevation MI. Whew, that's a mouthful. So what that is, it's a type of heart attack. When we take a look at your cardiogram, if you're having or if you've had a heart attack, a lot of the time there can be changes on the cardiogram. So an NSTEMI, a non-ST elevation MI, just describes what the cardiogram will look like, but ultimately it's a type of heart attack. How much exercise should you be doing? How much stepping should you be doing after that? Hard question for me to answer. If you're 35 years old and you had a really small heart attack, you know, after you've had after you've had about 6 weeks to recover, you can get an awful lot of activity in. If you're 85 and you had a really big, massive heart attack, my answer might be a little bit different. So this is one of these questions, without getting more of the background about the size of the infarcts and stuff like that, it's tough for me to give an answer. I will say this, exercise is always good. Generally, the more you're able to do, the better off you're going to be. A minimum target, not so much in terms of steps, but in terms of time, is 150 minutes per week. That applies to my 35-year-old and my 85-year-old. That's the target you should try and do. You should be pain-free with your exercise. And I always tell people, within 1 hour of being done, you should feel back to normal. If you're still really tired and that fatigue goes on for a while, then there's a chance that you probably overdid it, and next time, do less. Okay, so we've got our cool down. We are going to do our 2 resistance training exercises now. I think on Tuesday we did our step lunges, so today is squat day. So for squats, I like to use the kitchen sink here in the center. I have a chair behind me just in case I lose my balance. I can sit down comfortably. I'm going to hold on to the sink for a little bit of balance. My feet are about shoulder width apart. I'm going to stand up nice and straight and tall. I'm going to make sure I look forward. I'm not going to look down at my feet. I'm going to lower my bum to the chair as far as I comfortably can go. And we're going to do it 10 times. Here we go. And 2. And 4. And 5. And 7. And 9. And there we go. 10 squats. King of exercises. It's great for your thighs. Okay, the next exercise we're going to do is I thought we'd do something for our chest. We're going to do push-ups. And I know everyone at home is thinking, I can't get on the floor and do push-ups. But there's variations to push-ups that we can do that are really just as effective for your chest. We can do push-ups on the counter. We can also do push-ups on the wall. So I'm going to try and do a wall push-up here. It's a little bit tough for me because the counter's in the way and the shelves are in the way, well, not in the way. They're not as long as I need them to be. So for wall push-ups, what we're going to do is I'm going to put my hands in front of me, roughly at the height of my shoulder. I'm going to step back just a little bit. I'm going to keep my back really, really straight, and I'm just going to bring my face in towards the counter. It'll look something like this. Just like doing a push-up on the floor, but I'm going to use the wall because it's easier this way. So let's do 10 like this. 1, 2, 3, 4, 5, 6, 7, 8, and 9, and 10. There we go. And that works the triceps and the back of the arms when we do the push, and also the chest as well. All right, let's finish off with our stretching. Arm out in front of you, pull it across your chest. We'll stretch the back of the arm, the tricep muscle. Once again, I like to keep myself moving, especially after I've done all my cardio. Keep that muscle pump working, pushing that blood up to my heart and my head. Other arm out in front, pull it across your chest. And remember to breathe. And we do these stretches for about 15 to 20 seconds as a minimum. If you have time, you can go a little bit longer. Okay, we're going to stretch our chest now. So for this one, if you can interlace your fingers behind you, great. If not, just get as close as you can. And then what we're going to do is we're going to pull our shoulders back and just look upwards a little bit. And that's going to stretch our chest wall. Good exercise to do, especially if you've had surgery. If you've had a valve surgery or they had to open up your chest wall or bypass, might be a little stiff and a little bit tight. So this is a good stretch just to help your chest heal up. Should never cause any pain. Just go to the point where you feel a little bit of a pull. That's all you need to do. Okay, great. Shake that off a little bit. Next stretch is our runner stretch for our calves. So we can find a counter to push up against. Both feet flat on the ground. Both feet pointing straight forward. And we should feel that stretch in the calf of the back leg. All right, then let's switch to the other side. Once again, we hold them for about 15 seconds or so, or a little longer if you have the time. Longer is better, by the way. All right, and we'll finish off with everybody's favorite, our hamstrings. So many people have tight hamstrings, me included. So sitting on our chair, just having your bum close to the edge, not against the back, and have one leg bent, the other leg straight, and then just reaching forward towards your foot as far as you comfortably can. And for this one, make sure you do breathe. Should breathe for all of them, but some people forget on this one. Okay, and then let's switch to the other leg. All right, there we have it. Sorry, I went a little bit long today. I think we're about 35 minutes. All that talking. So let's just see if we have any last questions real quick. Q&A. How do you determine between chest muscle pain and heart pain? Well, so that can be a tricky question. It's one of the hardest things that we do here at Rehab. There are a number of different questions that you can ask. So for example, chest wall or chest muscle pain, tends to be tactile. So if you say, oh, Rob, my chest hurts, and I go and I poke in here and you say, ow, that hurts, don't do that. Angina pain typically doesn't have that pressure sensitivity. Muscle pain does. So that's one thing we could do. Angina pain tends to be related to exertion. So keep in mind that typically angina is caused when your heart is not getting all the oxygen-rich blood that it needs. So when you're exerting yourself, you need more oxygen-rich blood. That can bring about angina if you have unmanaged coronary artery disease. But then in that case, if you slow down the intensity of the effort, or you come and sit down, that decreases the demand for oxygen-rich blood. And if it's angina, a lot of the time the angina will go away. So that's a second thing. The third thing is nitroglycerin. If you've got established coronary artery disease and have a prescription for nitroglycerin, if you're having pain and you take nitroglycerin is a vasodilator, opens up your coronary arteries, which increases the supply of oxygen-rich blood. If it's muscle pain, nitro is not going to really do much of anything. So that can be a really, really complicated question. And ultimately, the right answer is to make sure you check with your doctor. Especially if it's new and it hasn't been diagnosed, it's critical that you don't listen to some guy like me. Go talk to your doctor who can ask the right questions, who knows you very well, and can follow up with any kind of testing that needs to be done to establish a good diagnosis. Those 3 questions I suggested are things that your doctor will probably ask, but there's a lot of other stuff as well. Okay? That was my questions. I've answered them all. So let me go back to sharing my screen. Let's bring my PowerPoint back up and just see what slides we've got coming up here. Bear with me, folks. All right. So sessions for Monday, as I said, my colleague Renee Kanitas is going to be doing a session on communication, relationships, and returning to sexual activity. So tune in for that one at 1 o'clock. It'll be a live webinar. And then the day after that, Tuesday, July 7th at 10 a.m. is our Women's with Heart Online. They also do a session where, similar to mine, where they do a variety of live exercises that you can follow along at home with. All right. So that is going to be it for our session for today. As I said, this is going to be our live session, last live session for the month of July. So do keep checking back on our website, Cardiac College. If I can get back online in August, that's where you'll see that information. All right, folks, all the best. Have a wonderful week. Stay safe. Keep exercising. And hopefully I see you all soon. Bye now.